Just some facts about amputation and diabetes mellitus. Listen keenly. In the United States of America, every 17 seconds, a person is diagnosed with diabetes mellitus. Every day, 230 Americans will suffer amputation as a result of diabetes mellitus. Then we will have 1,410 amputations weekly. Throughout the world, it is estimated that every 30 seconds, a leg is amputated. And that gives me the number of 2,880 amputations every day around the globe. 80 to 80% of all the amputations in the world are due to diabetes mellitus. And most of the amputations start with the diabetes foot ulcer. That means the door of entry for amputations is the foot. And the foot gets infected, a little cut somewhere around between the toe or in the plantar aspect of the foot or somewhere around here. And then because diabetes suppresses the immune system, it moves rapidly from the toe up to the skin. And if here is the affected area, the surgeon will have to go way up. And the time we plead with patients in the ward, please sign, it progresses. By the time the patient signs, 2 weeks after, above the knee. And sometimes the senior medical officer has to use her right to override the patient to authorize the amputation. Right? So the amputation were due to, most of them are due to the complication of diabetes mellitus. And experts say 80% of the amputation are what? Preventable. Right? And 85% of the amputations start where? The toe, the foot. In the UK, diabetes is the leading cause of non-traumatic amputation. Diabetes leads more than 176 legs. That means 176 legs, legs are amputated every week in the United Kingdom. And living with diabetes puts you at a higher risk than a non-diabetic to to have one of your limbs amputated. As I said earlier, this writer even goes lower than that. The lifespan after an amputation is within 2 years, 50% of the amputate are dead. So, amputation is just not amputation. It's a leading cause of death among diabetes. Of course, some factors must be taken into account. And when I was trained at the Montemorelos University, and I was talking to one of my professors, the professor said how so frustrated I was 2 weeks ago. They brought me this man without legs. To put him on the bed, you have to lift him. Without legs, but he's 200 pounds. And only to know that without legs, he's blind. I couldn't save his eyes. Without legs, now blind. And then one of the doctors stopped working, stopped studying to take care of him. He's not working, the doctor not working, somebody now have to be what? Maintaining. Because we are going to talk about the amputation, and the amputation starts with the foot, I thought it was appropriate to give us some functions of the foot. What really the foot is there for us. Number one, to support our body weight. I engage patient, age 35, weight 250 pounds, complaint, my knee hurts me. And I sit and say, oh really? Your knees are hurting? Yes, doc, my knee. And then my back. We have a scale where I work. Nobody uses it. Come around, come around. And they walk. Age 38. They say you're a young woman. When I say get up, you jump and get up and move. They drop. I said go on the scale. Silent in the hospital. Only Dr. Kombele uses the scale. I said, John, look, 250 pounds. Come back. Sit down. You don't have arthritis. You don't have anything else. It's too much weight leading to what? Premature arthritis. But is there a way? I said, no, you have to lose weight. When I start telling them what not to eat to lose weight, the eyes start running all over the place, Pastor Levi. I said, don't play, must stop. Oh, don't play, don't play. And I said, call me parents. Oh, God help me. And I said, rice and peace on Sunday, midday. Because the food helps to support the weight. But how much weight the foot can support. The other function of the foot is balance. You put one foot and then the other one, the whole process of walking must be also with balance. Right? And the third is to walk. We cannot walk without the foot. And then the fourth function is to absorb the shock. This is not really the right foot. The right foot should have a little arch here. We call it plantar arch. And then now, when you are too heavy, it becomes a bit flat. It absorbs the weight, right? this, you may not be able to absorb the weight. You can be falling from time to time. So to describe the foot, we're not talking about the foot, you have three sections. The front, the toes, and between the toes, right after the toes, you have the metacarpal, the metatarsal bones. They are longer than the toes. And then you have some other bones here, cuneiform bones, naviclavicular bones, and cuboid bones. It shapes like a pyramid. And on the top you have the talus bones and the calcaneal bones at the back. Right? So this is a good size foot. And the friend gave it to me. It goes in the shoe, but this is not the right shoes either, because it stretches your foot, right? And the more your foot is stretched, then you can have the heel spur pain on the sole of your foot. But for description's sake, this is good foot. How does the foot get affected with or by diabetes? Diabetes mellitus does not affect organs. It first and foremost affects vessels. And once the vessels are attached to an organ like the eye, those vessels become affected, then the function of that organ also becomes what? Affected. Every organ has three of the vessels. And the first vessel is the artery. The artery takes the blood from the heart to the rest of the body. One section of the blood flow goes down, and the other section must go up to the brain. And the carotid arteries are the doors by where the blood reaches the brain. And then in this lady here in the inguinal region, we have an opening where we have three vessels that run here. One is the femoral artery, the other is the vein, and we have the nerves. In the diabetic patient, three of them get what? Affected. And when the femoral and come down, go behind the legs, and some comes at the front, and then here we have the artery, dorsal pedis artery, and we have the tibia, the posterior, the anterior. At the same time, we have nerves. Nerves help to feel. You step over a nail, you feel the pain, and you have the nerves, sensory nerve that will collect that pain feeling, send it to your brain. Your brain processes the information. It is pain. Send the information to the foot. Remove the foot. Now, if that I'm caressing the foot, the nerve takes the information to the brain, and I'm caressing the foot, and the brain sends down the information to the foot, say, do not pull the foot. Do what? Relax and enjoy the caress. Now, when this communication through the nerves is affected, it's a big problem for the diabetic. I remember as an intern in an hospital in Mexico, We rush. A patient was admitted. He came to the hospital because he cannot remove his shoe. Now, the tummy between his leg, he couldn't bend to see what's happening. He was a farmer. He continued his duties. He went home. He tried, he came, he called the wife. When the wife looked, saw a nail, went through the shoe, entered the foot. The wife said, "You have been dragging this nail all the day. Go to the hospital." At the accident emergency, they couldn't pull the nail, so they admitted him to general surgery. And I followed my resident. We went to pull the man the foot. We did it even without deadening the area because all the fillings of the foot were gone. Right? Now, when you get infected that way, and you don't know, for many days, the infection leave the area, get in the skin, get in the bone, and start what? Spreading. So the problem with the diabetic is that the vessels are affected. And once the vessels are affected, the function of the organ also becomes what? Affected. Right? So, because we are talking about the food, there are risks associated for you to develop an ulcer that will lead to what? Amputation. Risk number 1, high blood sugar. Everything starts from the high blood sugar. All the complications of diabetes will not happen to someone who has a normal blood sugar. If your blood sugar is normal, bye-bye to the complications. But today is up, tomorrow is down. The 1 week, 16, 20, 15, and one time is 6. I said, when it's 6, we die of hunger because all over the place, you are just running the risk of developing what? Complication. And where the food is concerned, you are running the problem, you are running the risk of what? Losing your food. We are talking about the risk factors. If you smoke, stop. Smoking shrinks the vessels. And the arteries that's supposed to carry nutrients, glucose, to the foot, because they are reduced in size, they do not carry a lot of blood, and subsequently your food starts changing in what? Color. Because the oxygen does not reach there, the normal glucose does not reach there, the mineral do not reach there, the hormone, and by the time you realize, it is dark. And when the doctor now examines, no pulse here. The problem starts there. There is no pulse, that means there is no blood flow. And most of the problems on diabetics come in pairs. When you have eyes, more likely you have kidneys. If you have stroke, more likely you can have heart attack. Right? So, quit smoking. And of course, the damage of the nerve will lead into decreased sensation to the foot. Do not treat yourself where your foot is concerned. Do not remove the corn there. Do not treat the callus that you have there. You need to go to the doctor to be treated for that. Another risk is, of course, poor circulation. The history of a foot ulcer predisposes you to problems in the foot. Vision impairment, as it was said here. You do not see, you do not feel, so you cannot take care of the foot. Past amputations leads the way to more what? Amputation. And then high blood pressure can make the whole situation complicated. How do we prevent amputations? How? Inspect your foot every day. What do I say? Inspect your foot every day. If you cannot, put a mirror underneath your foot. Look through the mirror the bottom of your foot. Or let somebody examine. How do you examine? You compare one foot with the other. You touch. Is it too cold or too hot? You pinch this one and you pinch the other one. And you compare what? The way you feel. Number 2, wash your feet daily. You wash them every day. Number 3, to prevent, do not remove anything you see in your foot. Anything abnormal, you go to the doctor. Be careful how you trim your toenails. Find a pedicure, that's what you call them? Huh? Pedicure technician, nail tech, who knows how to trim the diabetic toenails. Do not walk barefoot in the house. You have a nail, you can step over the nail, you can bump your toe, you can have a blister, a cut, an abrasion, and if your sugar has never been controlled, that can lead to a problem. Wear clean and dry socks, preferably cotton socks, because cotton socks will not lead to wet surface. And then powder between your toes. Examine between your toes. You put the powder, you put the cotton, the socks, and they even advise that do not buy the shoes in the morning, because in the morning you have a smaller foot, and as time progresses, your foot gets bigger. So when you have to buy a shoe, buy it when? In the afternoon. You must be able to put a finger on the back. You must be able. And the shoe shouldn't be so tight. Because the shoe alone can cause what? Blisters or abrasion or cuts. That will eventually lead to problems if your diabetes is not controlled. Schedule your regular visit to your doctor. Do not miss your visit. When you go to your doctor, ask the doctor to feel the pulse. You know, people come in here, they cry, they smile, they give me a hug, and they pay. That makes my work nice. A lot of hugs. But that's not why I sit there hugging. You say, Dr. Gomele, the men come, some brave man say, check my prostate. I put my glove, I check the prostate. And some brave lady say, Doc, I don't like the way down there, I check. But diabetic patient, she said, Doc, check my pulse. And I put my finger here. Before you tell me below the waist, we have to look at here because everything starts here. Because if here not working properly, it will affect below the waist, above the waist, the brain. Ask the doctor to check the pulse if you are diabetic. Because this is vital. The time the doctor does not feel the pulse, that means there is a problem in the making.